Onto this conversation now, as the country awaits President Cyril Ramaphosa to sign the National Health Insurance Bill into law. Critics, including business, continue to threaten legal action, with the South African Medical Association questioning the funding model. Now, during the budget speech, Finance Minister Enoch Godongwana allocated 1.4 billion rand to the NHI, describing it as government's commitment to the policy. However, there is growing criticism over what many say is government's underwhelming allocation. And one of those who are questioning the funding of NHI is medical scheme Profmed. Its CEO, Craig Comrie, joining us now for a quick reflection of what we heard from the Finance Minister last week. Mr. Comrie, good evening to you and thank you for your time. If the NHI is going to be implemented incrementally, what's wrong with the 1.4 billion rand allocated for the coming financial year?
Well, I guess when you listen to the speech, the Finance Minister actually says that there will be 6.9 billion rand provided in the short to medium term, which means over the next 3 years, that's the allocation that NHI will receive to start the setting up parts of NHI. In fact, the Minister has allocated over the last decade just over 20 billion rand to setting up NHI, and that's before any service is actually being provided. And so the question now goes towards at what stage are the promises made around the delivery of service or the improvement of services going to come into effect? Well, they won't come into effect, is our opinion, in the next 3 years, because NHI, at its lowest estimation, is going to cost around 450 billion rand, and it could go anywhere up to about 800 billion rand. And so we have around 260 billion rand already in healthcare, in the public sector healthcare budget. There's no real move in the budget to actually budget for the additional at least 150, 160 billion rand at all.
Yeah. I've been listening to the conversation and in particular the opposition to the implementation of NHI from the private healthcare sector. And that's the sector in which you fall. Is the opposition, Craig, to do with the pooling? I'm talking about this pot of money that is going to be pulled from the public sector, pulled from the private sector. And if the figures that you bandied about are anything to go by, the estimates are that 600 billion rand per year is what is going to be needed for the NHI to genuinely be well on its way. Is the opposition, therefore, to do with the monies versus what the government says are services that must be extended to all?
Well, the opposition is definitely to do with how the money is managed. And so what we don't see in the NHI bill is a description of what actual services are going to be provided. In fact, most of the NHI or the NHI type of policies would be accompanied by a money bill. Now, the very fact that you reference the pooling of the money, the only way you can pool money is if you actually increase taxes. So the taxes that are suggested are things like VAT, income tax, corporate taxes, and even a payroll tax. So the only way you can pool money is through the increase of taxes. Now, we already know that in South Africa we are amongst the highest income tax paying rates in Africa, certainly. And so you cannot overburden what is a very shrinking tax population or tax paying population to try and pool the money. In a different way, the other opposition that comes in is the fact that as you pool the money, you put in the control of that money under one single Minister of Health. And so there's aspects of the NHI bill which really talks to the fact that we don't believe a Minister of Health should have total control on that single pot of money. And the easiest example to explain is probably the Eskom example. The fact that you have a single provider and distributor of electricity is exactly the template that the government is moving away from in terms of electricity provision. Yet in the healthcare, we're doing exactly the opposite and removing what the very purpose of the NHI Bill was, is to actually create access and equity to everybody. We believe that that is exactly what this is going to work against, and we see lots of movements, specifically amongst doctors and specialists, in terms of people like Sama, that indicate that those doctors and specialists are seeking opportunities elsewhere in the world because they aren't trusting an NHI and a centralized single-payer model, which is NHI.
As a medical scheme CEO, as a private medical scheme CEO, what concerns you most about the NHI?
Well, there are two things that concern us most. In most national health systems or universal health systems, you find that individuals have choice and freedom of choice in terms of buying alternative cover if they do not want to go to the state-offered NHS or NHI. In the way that NHI is actually formulated here in South Africa, that bill forces everybody into the same space and removes medical schemes and private funders from the equation. In actual fact, it legislators medical schemes to a top-up complementary-based role in the system itself. And so we're saying that type of system doesn't operate anywhere else in the world in any successful fashion. You still need to allow people to choose how and where they want to access healthcare, and effectively remove the burden on the state to provide healthcare services to those people, and use the remaining pot of money to do the best you can in actually providing services to the rest. Now, our suggestion, in fact, is that there's closer working relationships in the public and private funding mechanisms so that people can access private facilities, and as many medical scheme members already access public sector facilities where there are centers of excellence in the public sector. And we fund those. So the best way to actually get a pooling mechanism going is to offer better access and better quality services in the public sector, and in a natural way you will attract additional private sector funding into those areas.
Well, based on what you've just said, then it means that there's got to be more conversations between yourselves as a private healthcare space and government. And I want to end the conversation on this note, because this weekend, although he was speaking in his capacity as leader of the ANC, President Ramaphosa reiterating that NHI will be implemented over 5 years, and that this bill that is on his desk will, quote unquote, be signed. What's your next move? How do you convince him not to sign it in its current form, because you clearly have a problem?
Yeah, well, we've been discussing the bill for probably over a decade now. In fact, all the suggestions provided by the private sector in terms of how the bill could more easily promote universal health care have been disregarded. And so there's two aspects that come into play. We absolutely believe that the President will sign the bill into law, and that would be politically expedient for him to do so. However, the challenges will then come through. We have petitioned him and asked him to please check with the Constitutional Court or send the bill back to Parliament for those aspects of the bill that are unconstitutional. In the interim, we're ready, in fact, to challenge the bill constitutionally on two bases. One, the fact that it does restrict choice of people accessing health and paying for it themselves. And secondly, the process of getting the bill through Parliament and to this stage is done without proper consultation and without proper consideration of all the submissions that we have made over all these years.
Craig Comrie is the CEO of Profmed. Thank you very much for your time. So, still a long way to go if the President is to sign this bill.